Hi, my name is Alyssa and I'm with Knob Noster Physical Therapy, and today I'm going to be showing you part 2 of our hip abduction strengthening series. And today we're going to focus on a side lying and a standing hip abduction. These are a great step up from the isometric training that we showed you in the last video, so if you haven't seen that one, go ahead and check that out. But today we're going to be working on a table. You can also do this on your couch, your bed, on the floor if you can get there. But this is a great option, and I'm going to show you a couple progressions of this one as well. So depending on what you may have in your house today, I'm going to show one with an ankle weight like we have in the clinic and also a band. So for this technique, we're actually going to lay on our side. Your bottom leg will be bent up just in a comfortable, nice resting position. And with our top leg, we're going to make sure that it is slightly behind us. So this is an important step to make sure that we are hitting that gluteus medius and gluteus minimus muscle and not compensating with other muscle groups. So you want that just slightly behind you, and we'll want to make sure that our hips are nice and straight up towards the ceiling. So with this, we're going to start resting your leg in a comfortable position. Usually that ends up on the table or the floor, but depending on your mobility limitations, it may not do that. What we're going to do is raise straight up towards the ceiling, making sure we stay back behind us just slightly. It doesn't have to be way back there, but just a little bit helps keep that muscle nice and activated. And we're just going to lower back down. So these, I like to start people with 10 to 15 and then work up to 30 to 50 depending on what your goal is. Endurance based, which is important for gait and ambulation, especially for longer distances or running. We like to do a little bit longer and higher rep range. So working up towards that 30 to 50 depending on what your goal is. When you're ready, and that's super easy, we can go ahead, we can add an ankle weight. So that's just as easy as throwing that on. And you can try to maintain the same rep ranges that you've been doing, but if you need to back it back down with that extra weight, you can absolutely go back to that 15, working yourself up, back up to that 30 to 50. Another option you can use that we have in the clinic is actually an exercise band. So go ahead, tie it in a loop, or if you have a longer one, you can tie it around your legs. Now there are a few different positions that you can put the loop in. So up around the knees is a good place to start, as this is a little bit easier, tends to be a little less resistance depending on if you just have a stronger band or are just beginning with this variation. The further you move it down your legs, the harder it is going to be. So I'm going to demonstrate down with it at the ankle. So for this one, you might have to straighten that bottom leg out just a little bit just to keep that band where it needs to be. But same thing, bringing that leg just a little bit behind us, and we're going to raise up towards that ceiling. The band is going to give you a nice solid resistance. It's going to be a little harder at the top. So if you want a little more of a challenge, go ahead and try to hold that movement at the top for just a second or two, and then coming back down. As always, if we can help you in any way, go ahead, feel free to call the clinic or check us out at knobpt.com. Thank you.